Assalamualaikum warahmatullahi taala wabarakatuh. So I'm Nora Dasaidi from Faculty of Accountancy, UiTM Cawangan Kelantan. So today I'm going to present about my research topic, which is the relationship between mental health and academic performance, a literature review. Okay, this is my presentation outline. Okay, for introduction parts, so the academic performance of university students is influenced by various factors, including their mental health and physical well-being. Based on a 2015 survey that has been conducted by the Malaysian Ministry of Health in 2015, it is projected that mental health would be the second most significant health concern following the cardiovascular illness by the year 2020. These prevailing mental health issues among Malaysian aged 16 and above has increased significantly from 11.2% in 2006 to 29.2%. The highest prevailing of mental disease is observed in the state of Sarawak, Sabah, Kelantan, and Kuala Lumpur. Furthermore, the survey also discovered that 20% of teenagers aged 13 to 17 years old has experienced depressions. 40% of them experience anxiety and 10% of them has experienced stress. And regrettably, a disheartening 10.1% of these young individuals have engaged in suicide attempts. Therefore, the objective of this study is to review to develop a conceptual framework that explores the relationship between mental health disorders and academic performance. An in-depth examination of current studies underscores the complex relationship between depression and anxiety and their detrimental effects on academic performance, as well as the positive impacts of social-emotional skills and resilience. These issues also emphasize the significance of using a wide variety of coping strategies that are customized to the specific circumstances and needs of individuals. And then the possible strategies could involve in improving cognitive abilities, leveraging technological progress, and fostering psychological resilience. Therefore, students can successfully navigate their mental health difficulties while balancing the pressures of school by implementing these coping strategies. Okay, next one for literature review. So this is an overview of mental health. Mental health here refers to the conditions of one mental well-being, which allows individuals to effectively manage the challenge of life, recognize and utilize their skills, perform optimally in learning and employment, and make meaningful contributions to their community. So it possesses inherent and utilitarian worth and is essential to our overall well-being. This is according to a World Health Organization. According to the data from 2019, there were a total of 970 million individuals worldwide who were affected by a mental illness, with anxiety and depression being the prevailing conditions. Okay, next one. This is the a review of the previous literatures. Okay, so we have analyzed few past previous studies. The first studies has examine the impact of climate change, price increase, energy crisis, labor conditions, including mental health and academic performance. And then they have discovered that 50% of the respondents worry about the mental health. However, they believe that the scenario does not impact on their academic performance. Okay, as they get older, the impact on them would increase. And then another studies who have examined the social emotional skills among secondary school students. And then they have discovered that a significant positive relationship across all social and emotional skills and academic performance. Okay, next studies, Siddiqui and Haq 2024, who have examined the factors affecting student academic performance mediated by motivation for learning, and they have found that there is a positive correlation between the physical and mental well-being of students and their academic performance. And then next studies, Maskini et al. 2024, who have examined the relationship between depressive syndromes, anxiety symptoms, and academic performance in Morocco. and they have discovered a significant correlation between severe depressive illness and decreased academic performance. Okay, next studies will be at all 2020 who have examined the impact of stress on academic performance in Nigeria. So they have found that both academic and non-academic stress had a positive impact on student performance, and coping strategies employed by the students could also mediate the effect of mental stress, of academic and non-academic stress on academic performance. Okay, next studies more at all 2024 who have investigated the correlation between social media addictions and academic performance in China. So they have reported a detrimental correlations between social anxiety and academic performance. And then they also discovered that the trait of social anxiety, including hesitancy, avoidance, dread, impede students' engagement in learning activities and academic integrations. Okay, next studies, Thorman and all 2023 who have examined whether the four psychological factors, including perceived stress, student involvement, resilience, and growth mindsets, can predict the academic performance of students. And they have discovered that perceived stress was shown as a substantial predictor of GPA, and subsequent moderation studies show that the resilience act as a buffer which could weaken the association between the stress and the academic performance. And next studies, Gregory et al. 2024, who have investigated the mental health attributes of Australian school children, and they have make a profile of five distinct mental health profiles, which is complete, good mental health, moderate mental health, symptomatic, but content and trouble. And then they have discovered that a student who was symptomatic yet content, had intermediate mental health, or just were distressed, perform worse academically as compared to the student with complete mental health. Okay, next studies, Oliveira Silva et al. 2023, who have investigated the perspective of undergraduate nursing students regarding the factors contributing to their academic performance. And they have discovered that the student perceive that their academic achievement, physical and psychological well-being, interpersonal relationships, including with classmates and professors, family structures, would influence by their actions. Okay, next studies is Mir Hosseini et al. 2021, who have examined the correlation between depressions and academic satisfaction among students in Iran. So they have discovered that the average depression score among the participants were 71.92, and then there was a significant and negative correlation between the depression score and student academic satisfactions. The higher the depression score, the lower, the poor the performance, the academic performance of the student is. Okay, next one, next studies is Ratana Suripong et al. 2022, who have examined the psychological elements that influence the academic achievement of nursing students. And they have found that the study revealed that nursing student academic performance was influenced by characteristics such as family difficulty, emotional negativity, self-esteem, and substance use. Okay, in conclusions, from the above review, so there is a complex relationship between mental health issues, including depressions and anxiety, and these mental health issues could give a negative impact on students' academic performance. Okay, next one. We have also have identified several coping strategies in the previous studies. Okay, the first one is executive functional skills. Okay, the previous study have revealed that cognitive inhibitions, task beginning, sustained attentions, planning, and time management had a role in connecting emotional difficulties with academic achievement. And another studies have discovered intelligent agents as a coping strategies. So intelligent agents such as social robots have the potential to enhance student mental well-being by providing activities and tasks such as meditations, yoga, maintaining a good diet, and this could assisting in with relaxation and positive thinking, which eventually could reduce their mental issues. Okay, next one. Another studies have found that psychological SUSI has the ability to regulate the impact of both long-term and short-term stress on the poor aspect of college student mental health. However, they have discovered also it does not the psychological SUSI does not have the ability to moderate the impact of the positive aspect of mental health. Okay, so as a conclusion, the previous discussion has emphasized the importance of interdisciplinary collaborations, informed by research findings from psychology, education, technology, and public health, in developing a comprehensive and culturally sensitive strategies for supporting student mental health and academic success in diverse educational setting. Besides that, by addressing the complex interactions of factors influencing mental well-being and academic achievement, stakeholders may work together to create supportive learning environment in which students can thrive both personally and intellectually. That's all from me. Thank you for listening. Assalamualaikum warahmatullahi taala wabarakatuh.